Good morning. My name's James Stanger. This is a very quick video doing a product review of a new release called Imply, which they say is the biological interface of the future. It's pretty groovy. This is a little insert sitting on the skin. So this video was prompted by a newsfeed article that came past my desk this morning from Imperial College in London, talking about a patch tracks hormone levels in real time for patients with infertility. And this is the URL for the Imperial College product release, and this is the website for Imply, which is the product that we're about to talk about. So Imply, a startup working with the innovations from Imperial College in London, has been awarded a $1.4 million grant to begin clinical use of a continuous hormone monitoring patch for infertility. As they say, and this is from the college's promotion sheet. They say timing is crucial for IVF, the most common form of infertility treatment, yet the way most patients are treated falls far short of what biology demands. Currently, most women on IVF have blood drawn every other day at best. Hormones can shift significantly within the hours, and in an ideal world, clinicians would want several measurements of a day to track those fluctuations accurately. This means that critical events such as the hormone surges that determine egg release, the dips that cause implantation failure, or early signs of ovarian hyperstimulation syndrome are routinely missed. In a treatment with tragically low success rates, these uncertainties have real consequences for patient outcomes and well-being. And this is what the patch looks like, a small inset that sits on the skin, several biosensing probes that sit just under the subcutaneous layer and measuring the fluid, not directly in your blood as you would normally see, but in the subcutaneous tissue, and all the electronics for signaling and measurements. And they say the biosensors continuously measure the hormone estradiol, luteinizing hormone progesterone. The data collected is then transmitted wirelessly to a smartphone where AI algorithms convert raw signals into real-time hormone trends. And then they just finish off by saying, continuous hormone monitoring has the potential to change the landscape of fertility treatment, both in terms of clinical care and patient experience. Rather than snapshots taken at fixed points in time, with Imply, we will have access to a live feed for each patient's hormone response, allowing us to personalize care in a way that has not been possible before. Okay, that's fair enough, and I wish them all the best for them. So why is this of interest to me? Well, when you look at what's being produced, this is a real-time graph of estradiol, luteinizing hormone, and progesterone, which is slowly rising. And so it remains to see whether this patch will deliver data in a form that clinics can use for tracking for IVF and ICSI. I have emailed them. I haven't yet got a reply on it because I just sent the email off this morning. But it's a question of whether the hormone levels that the sensors can pick up are applicable to natural cycles, but also to IVF cycles, where some of these hormone levels can be up to 10 times what occur in a natural cycle. It's also shown up measuring FSH and AMH, but I suspect the new sensors in the future may be able to do that, and I hope they do. But the reason I'm doing the video is because there's been a transition in IVF the last 10 years. This is data from CSC in America, looking at how embryos are being transferred back from 2013 to 22. So that's 4 years old. It'll even be more so now, but there's been this huge trend in the rise of frozen embryo transfers and a fall in the number of fresh transfers. And that's mainly because of the promotion of blastocyst culture and PGT-A, which have prompted this huge surge in frozen transfers. Now that's fine, as you say. However, I've now produced quite a few videos reviewing publications which clearly demonstrate there is now sufficient information to imply that the use of HRT cycles for FETs that do not have an active corpus luteum have a significantly higher incidence of pre-eclampsia. All the studies suggesting it is in women's best interest to have a natural cycle FET, but these are messy to manage on a large clinic-wide scale. In fact, most clinics, in a mad rush to use PGT-A to find the best embryo to transfer, will continue to use HRT cycles because they're just because they can be planted, and they're not that worried about whether there's an active corpus luteum or not. Therefore, but however, they're putting the patients at some risk because if they're using HRT, FET, as the women get ready to deliver, then there's a doubling the incidence of preeclampsia from about 8% to 15, 20%. And even though I don't know that anyone's died, there will be deaths as a result of preeclampsia. As I understand it, and I'm not an obstetrician, obviously, I'm a mere scientist, that preeclampsia is a significant health issue both for the woman and the baby. Um, so I think there's something we need to be focusing on. But a lot of clinics are sticking their head in the sand with this because trying to manage lots of FETs are really difficult if they're doing natural cycles. And that's the reason the video, because therefore, if this technology can assist clinics to plan the day of transfusing real-time data to identify the mid-cycle ovulatory surge and the rise in luteal progesterone, it may be the key to employing natural cycles for FET. So that's why I did the video. One cannot foresee how their use may impact fertility and infertility management and future AI involvement, but it may increase awareness of women of their own fertility, and that can only be a good thing. There is this huge trend of women having IVF in their late 30s with all sorts of problems. And if they're using these monitors early on, maybe to try and fall pregnant in their late 20s or whatever, it may give them some clue early on about whether they're the AI may be able to look at their profiles and suggest they should be having fertility treatment sooner rather than later. Maybe pre-fertility diagnosis of ovarian reserve and review prior to fertility treatment could allow better coordination of first treatment or directions in terms of doses, etc., or planning how they're going to be managed. So they're a far better idea of what's going to happen. And there may well be like nationwide collection from fertility centres may aid in fertility planning and research, a bit like semen analysis does for male reproductive health. I know it's a long way from early release of new innovation to real-world implementations, but for me, reducing the risk of preeclampsia is the driver for me, but it will be more for other people. I just wish the company good luck, and I look forward to doing a review of some of their publication on the efficacy of it sometime in the future. So I'd like to say I'm not a medical person. This information is not medical advice, but it may help you in knowing what questions to ask about your treatment with your doctor and maybe to help in understand the advice you receive. If you like what I'm doing, press subscribe or like or leave a comment or do all three. This site's underpinned by my other business, which is providing an online training and EQA program in andrology and embryology. So if you got to this far in the video, not everyone does, but if you do, I'd like to thank you for persevering. I hope it's been of value. And if you'd like more information, please tell our clients about this service and please subscribe. And on that point, I will say goodbye.